Well, good afternoon, everyone. We are here on May the 11th. It's Monday, and we're going to do, of course, another one of our live community and media briefings. I want to thank everyone. We do our briefings, of course, every single Monday, Wednesday, and Friday, right at 3 p.m. We also do a Spanish translation. So después de las preguntas, también lo tenemos en español, un resumen. And so we'll do that Spanish translation at the end. And Teresa Ayala Castillo from the Health Department will do that for us. Of course, we have Paola, who's doing our ASL translation, and Dr. Davis, who will be doing an update right after I give an overview of what's going on today. So I want to start, as usual, with all of the numbers in Long Beach. We have 953 individuals that have tested positive for COVID-19. We've lost now 45 Long Beach residents to the virus, which of course is a number that continues, as we know, to track upwards, and of which is incredibly tragic for us as a city. Of those 45, 35 of them have been associated with our long-term care nursing skilled facilities, and 10 have been through community transmission outside of those facilities. And so that number, of course, has remained low. We hope that number continues to stay low, but we're very, of course, cautious as we move into these slow reopenings in the weeks ahead of us. There are 50 individuals right now that are hospitalized. Please know that number, of course, fluctuates at any given hour, but as of a snapshot is where we are right now. There are 50 individuals that are in the hospital. And we know that that number is key to us as we look forward to the week ahead to ensure that that number is not spiking in any way. And that's something that we have to be aware of as these kind of slow reopenings begin happening, not just in Long Beach, but really across the entire region of Southern California and the entire state. Of the 953 individuals, about 620 have recovered. So that's, of course, a good sign, but we're always hoping for more and more folks to recover. The sooner, the better. So this weekend, I want to talk about a few things that happened. The first was a really great event, and I want to thank everyone involved in the food distribution event that we had in North Long Beach. Especially, we want to thank Long Beach Councilman Rex Richardson and California State Senator Lena Gonzalez, the Los Angeles Food Bank, and our friends at the LA County Labor Federation for really organizing a successful event. And there were partners, of course, the City of Long Beach, Food Finders, CalFresh. They gave out about 2,600 boxes of food were distributed, enough to feed over 10,400 people. And that is an amazing amount of food. And so it was both great to see that, but also really reminds us of the real tragic and really sad cost that this virus is having on the community, and people are desperate for food and for supplies. And so thank you to all of those who organized that event. The line to pick that food up at Jordan High School went all the way down Atlantic into Bixby Knolls. It was over 2.5 miles long of cars trying to get food. And we saw very low income individuals, we saw middle class families, we saw students. We saw a lot of people that are struggling, and I want to thank everyone for working on that event. I also want to talk a little bit about testing. Testing continues to be a priority. There have been over 17,500 tests that have been conducted in Long Beach. We need to do more, but that's a good sign. And we want people to know, if you think you need a test, whether you're symptomatic or you're not symptomatic, but you're working on the front lines, please go to the website, our COVID-19 testing site, because we want you to get tested. We have a large capacity to do so with 6 testing sites, so please get tested. We know that over the weekend, any retailer in Long Beach that wants to open with curbside pickup is now allowed to do so. And so we have curbside pickup only. We saw some additional retailers open up. Obviously, we're asking them to follow safety protocols, including proper physical distancing and sanitation. And so to those that were able to open, congrats. I know it's still a very hard economy, but we're trying to support those businesses as well. This weekend, we also had our trails open up and some of our golf courses, including the Forest Wetlands, the Nature Center, Willow Springs Park, as well as many of our golf courses across the city. We have seen and we saw an increase of individuals out at these locations. Most people were being safe. There still continue to be individuals who choose not to follow health guidelines. That is really unfortunate. And we're asking people to do the right thing and to take care of each other and follow the guidelines. And then, of course, we know that starting today, we're opening even more public recreation. So our beach, bike, and pedestrian path opened up this morning. So far it's been okay. We are still requiring physical distancing. We're trying people not to gather. Of course, we need gathering to not happen on the beach, and we need folks to really take care of each other along the bike path. In addition to that, to the beach and bike path opening today, we have our tennis centers and courts in the city reopening with, of course, physical distancing protocols, and any restaurants or concessions are takeout and really pick up kind of curbside only. And so that's something that's important as well. Want to remind individuals that we had extended the street sweeping citation holiday. It was going to end May 1st, and that got extended all the way to May the 15th, and actually May 18th, I believe, is the first day where there'd be a sweeping that would happen. But as a reminder, we're putting right now reminders on cars. We need people, we need to street sweep. Now we're at a point where it's a health and safety issue. We've provided over 4,000 free parking spaces across the city to go park cars. And this is something that we have to start moving towards again. So please, just as a reminder, enforcement begins again on May 18th. We're happy to park your car for free in one of the 4,000 spaces across the city. And that information is available on the Long Beach website. But there's been about 1,400 of you that have taken us up on our offer for free parking. We hope more of you will do that as well. I now want to talk a little bit about where the data is. So a lot of folks are asking, now that curbside pickup is open, now that recreation has slowly reopened, what's next? And just as a reminder, we can't even talk about what's next until we look at the data. And so we're going to take a hard look at the data at the end of this week. Then again, we'll start looking at the data and a hard look over the weekend and into next week, because you really need typically about 14 days of indicators and of looking at the data to ensure that there isn't a trend or a spike upwards. And so we'll be looking at hospitalization numbers over the next days ahead. We'll be looking at our hospital capacity for beds, at PPE supply, at ventilators, all those data points that allowed us to get here. We want to keep those moving in the right direction, and that's what we'll be looking at. Now, there's a lot of other businesses are anxious, but as a reminder, we are aligned right now with much of the county and the state, and that's where we are currently. You may have also been hearing some announcements today about LA County and LA County beaches. LA County just within the last hour or two officially made clear that LA County beaches are opening and reopening this Wednesday. Just as a reminder, in Long Beach, our beach bike path and pedestrian path, of course, are already open. And we expect to tomorrow put out all of our information as it relates to beach openings with what's going on with the county. So I think most folks know that we are working closely with the county, and I certainly was on a call this morning with county leadership on this issue of the beaches. And so we'll have a lot more information that is Long Beach specific that we'll be putting out tomorrow, but you can certainly expect that as the county is moving to reopen their beaches all to the north of us Wednesday and beyond, that Long Beach is having those conversations with our county health partners, and that we're looking at making some adjustments there as well. As I turn it over to Dr. Davis, I just want to thank you all. Everyone was generally very supportive of the ordinances this weekend. A lot of folks stayed home still, which we appreciate. Folks that got out needed to go out to enjoy the outdoors. We understand that. Please physically distance. Please wear face coverings when you can. Well, you have to, of course, when you're outside around people. But if you're alone, it's always just the safest way to get around, and we encourage that. And certainly, if you're going into a location, if you're around others, you're required to wear those face coverings. And then the final thing I want to say before I turn it over is, if you want to again help us fight COVID in the future, fill out your census. That'll take you 5 minutes, and you can do so today by going to the Census website, which is my2020census.gov, my2020census.gov. You can fill it out to make sure that we're getting the federal funding we need for COVID-19. And so with that, I'll turn this over to Dr. Davis.
Thank you, Mayor. Good afternoon. I'd like to reemphasize some of the Mayor's comments regarding physical distancing. Now that outdoor spaces are opening up, we want to emphasize how important it is to maintain physical distancing and to wear facial coverings. When we put out the Safer at Home orders, it was all of a sudden like a light switch. And as we look forward to getting back to normal, it may be helpful to think of it more like a gradual dimmer switch of opening back up. Unnecessary close contact with anyone outside the people you live with remains just as much a risk now as it did before, a few weeks ago. We're slowly and carefully turning up the dimmer on our activities while continuing to minimize the risk of transmitting this virus. As you enjoy our newly reopened trails, paths, and recreational facilities, continue to stay 6 feet away from those who don't live with you. Wear a face covering when you're unable to maintain that distance. Wash your hands often, and don't go out if you're sick or you don't feel well. As hard as it's been to not get together with family and friends, please know that we're not there yet. Gathering with people who don't live in your same household is still prohibited under the Safer at Home order. If we go too fast and open up too quickly, we might see more infections, and then we'll have to dial backwards and turn the light back down. The best thing we can do for those we love and miss is to continue staying at home and connecting by phone or video chat. Thank you.
Thank you, Dr. Davis. And we'll take some questions from the media.
Thank you, Mayor. Thank you, Dr. Davis. The first question is coming from Rachel Jordan from ABC7. Go ahead, Rachel.
Hey, so this question is, I guess, for the mayor and for Dr. Davis. Do you think we will ever get to a time where people without symptoms who are asymptomatic, who aren't frontline workers, could get tested for coronavirus in Long Beach?
You know, I think we both know the answer to that, which is yes. That's where we're right now headed. The interesting thing is we are essentially close to capacity right now, and so one of the things that we are I think having conversations about is the priority has to be people that are symptomatic and asymptomatic frontline workers that are at the most at risk, including everyone in our nursing skilled facilities. What we saw happen in some locations that were seeing not anyone that was non-symptomatic was they were being overburdened, and other folks that had symptoms were having a harder time getting appointments. And so that was concerning to us as well. And so we are kind of triaging everything we can right now to get the most people at risk, but knowing that that is on its way. And we are seeing, to be very frank, we're seeing a lot of people that are non-symptomatic. And so essentially, if folks are out there working today in all these industries, they're getting tests, and we're testing them. And so I think there'll be hopefully more to come soon on that. But I think that's something we discussed at the health department, Dr. Davis.
Yes, that is where we will be expanding to in the future throughout the country, not just in Long Beach, as our supplies allow and as more people are being able to work and leave the house more regularly.
All right. Thank you, Dr. Davis. Thank you, Mayor. Next question is from the Long Beach Post, Stephanie Rivera. Go ahead, Stephanie.
Hi, Mayor. Just wanted to know, I know businesses were opening over the week, and I saw flower shops opening as well. Wanted to know if any Long Beach businesses violated the health order over the weekend and if they had to be shut down.
So I don't know the answer to that. I don't, not that I am aware of. It may have happened that I'm not aware of. The report I did get was that the health department, the police department, the management team all felt that overwhelmingly that businesses were complying with the health order, and that when they went out and did checks, that it seemed like there was compliance, and where there wasn't, reminders were being made, but that it was actually a very good weekend as it relates to retail business. That I don't know if I got that correct. That's what I heard.
And a lot of education. So, and I haven't heard of anyone needing to be shut down, just more kind of working in partnership to be as safe as possible.
All right. The next question is from Philip Zonkel. Philip, go ahead.
Hi, this is a question for Dr. Davis. Last week's California State Senator Scott Wiener introduced a bill requiring data collection that would show COVID-19's health impacts on the LGBTQ community. Earlier in the month, in April, he sent a letter to Governor Newsom asking him to instruct all of the state's health departments to collect this data. Equality California, California's largest LGBTQ civil rights organization, is a sponsor of Scott Wiener's bill. And both Wiener and Equality California and other health advocates have consistently said by not collecting data on the LGBTQ community, they're being erased and treated as if they are invisible. You had mentioned a couple of weeks ago that that data is being collected. However, I did a little bit of research and it's actually not being collected. Apparently what you were referring to is the gender of one's sex partner. That's what I was told by the city, but from all the health officials I've spoken with, that would not get anywhere near to address the problem they're referring to. So I'm just wondering again, what this resistance is you seem to have to instruct the department to collect this data when people are asking for it.
Thank you for that question. I think one of the biggest things that in general has been an issue for this type of data has been just getting reports from providers in general. So the data collection in general is, and this is for all communicable diseases, has not been as good as it could be. People are busy, they don't necessarily fill out the forms that they need to. Some laboratories report directly, some don't. So the emphasis really right now is just to get the basic data that we need to get the actual reports of the cases. We will continue to look at getting all sorts of complete data. Sometimes that happens later on. Like a lot of times, people come, academic institutions and different groups will come and they will look at data and they will find out more of that type of information. And it'll also be collected in different ways, such as surveys and things like that. So I think right now we're trying to get the best data that we can that will help us to limit the transmission, and still realizing that there's a lot of data gaps that need to be looked at and addressed. But it just might not be what we can do right in the moment of trying to stop a pandemic.
All right, great. Thank you, Dr. Davis. The next question is from Jeremiah from the Long Beach Post. Go ahead, Jeremiah.
Hi, guys. Thanks again for taking our questions. And I just wanted to see if I can get a little more clarity on the beach issue. Should we be expecting Long Beach to follow LA County's lead tomorrow when they do open up beaches? Or is there going to be something we're doing differently? And also, I kind of wanted to get an idea on the thought process behind the timing of announcing openings every couple days. For instance, you had the beach bike path today. A couple days before that, you had the trails and some retailers, and now the beach is probably coming soon. Why are those being rolled out every couple days, especially when you said you need about 14 days of data to see if something causes a spike or a problem?
Yeah, we can both chime in if so I think the way we're viewing this area of openings is kind of all one opening, just done over a couple days. And so the discussion has always been this kind of curbside retail piece and this initial outdoor recreation piece, and just what days those kind of fall on. And so in Long Beach's case, and the counties, we went with the retail piece, of course, on Friday. And some of it is just a function of also of enforcement and making sure that there's capacity to monitor and kind of patrol everything. And so the decision was made really at the advice of the health department to do the outdoor recreation piece on Monday because it would give the staff the ability to kind of monitor the retail piece and then monitor the additional piece as a phased-in approach. And as a reminder, the county didn't do any sort of beach reopening today, right? They're waiting completely for on Wednesday. And I think the health department has always known that we were going to also do kind of the greater beach piece, but that they wanted to phase that in also to make sure it just wasn't a rush to the beach all in one day.
And yeah, I think it's like what the mayor said. It's more of it wasn't like looking at the data as much it was looking at compliance and kind of seeing, once we opened one part of things, how it went as we're planning to open everything at this time. And there was one other. So that was basically, and then because it was a holiday weekend, that was the other thing. So we just wanted to be kind of careful and gradual because that is a holiday where there might be a lot of people out and about.
Oh, that's actually right. I think Dr. Davis mentioned a point that I didn't say also, which was the Mother's Day question was something that came up also. Is there was a concern maybe that Mother's Day normally is one of the busiest days of the year, and so everyone kind of thought that Monday for most of that outdoor recreation piece was better. I will add one more point though, that Jeremiah, that you said, because I think this is really important now, because now that the outdoor recreation piece is complete and or almost complete, and the retail curbside piece is complete, I don't think anyone's expecting at LA County Health, at least the conversations that I've had, or at Long Beach Health, that there's going to be additional movement on Thursday or other things are going to happen. I think we've had this initial opening, and we've opened up the outdoor recreation, and we've opened up the curbside retail, and now we've got to really kind of take a look to see what happens with those openings before whatever comes next. And so I think there is going to be a little bit of a pause here to see how things roll out, and there should be. And I think that's what our health department's been saying. Dr. Davis, if you want to add to that as well.
No, I agree. Yeah, slow and steady.
All right, so that does it for the media questions. We're actually going to go into our Facebook Live questions here from our community. And so the first question I'll go with is the mayor. And Mayor, this is really relevant to some of the financial impacts that people are experiencing. And this is about a question relative to helping commercial landlords and tenants who haven't been able to collect rent due to small businesses that have had to shut down. What kind of programs are you aware of that are out there to help those landlords that are struggling, not only the ones that are tenants dealing with this process?
Well, I mean, I think first, anyone that's struggling, you should call, particularly if you're on the commercial side, property side. I would contact the Economic Development Department. There are programs out there. The city has programs, the state has programs that are looking at some of that stuff. But I think that, obviously small property owners want to make sure that the tenants themselves have assistance. And I think at the end of the day, people are struggling. And even though we've had this, there's an eviction freeze and there's other things that are in place, people need direct resources. And I think a lot of us have talked about getting off programs that would provide more direct assistance to residents so that they can pay the rent and that they can pay their landlords and the property owners the rent, and that it's not all just compiling at the end, which is going to be problematic. So the city is working on this issue. Obviously, we're hoping the federal government steps in a big way on this, which we're still counting on. But the city is also looking at this issue, and I hope that in the kind of week or so ahead, we should have more information about this and some additional programs that we can do to put out to help people.
Great, thank you, Mayor. The next question, and obviously this goes back towards when are we going to open things, and we've tried to answer these questions to the best of our ability as it relates to the phases. The biggest question that we have on our Facebook feed here is relative to churches, and I would say followed shortly thereafter by small gyms and fitness centers, and then again, restaurants. Mayor, can you elaborate as you continue to do a little bit more about those types of facilities and locations?
Yeah, the truth is we just don't know. And so all those are important functions. I mean, obviously, for churches, such an important place for people. And the other ones that were mentioned, small gyms, grooming, all of that. Just as a reminder to folks that even if Long Beach felt that it was safe to open all of those locations tomorrow, we legally couldn't open any of them tomorrow. So there is a statewide health order in place that does not allow any of those locations to be open yet, or to even be contemplated to be open. And so right now we are in this, in stage 2, early on. We've just opened up the initial grouping of retailers, curbside, and the recreation. And I imagine, and I expect, like we're doing, that the governor and the state are going to now look at the statewide indicators over this next week before anything else gets opened up. And so what opens up next and when it's open, it's completely dependent on the statewide and, for us, local indicators on the data, and particularly the hospitalization data.
Mayor, this also lends itself to the fact that we're starting to open up tennis courts and some of these activities outside. And this has been a question that's coming up now about, for instance, when can we at least use the baseball or softball fields, or sit in the park and have a picnic if we are maintaining social distance, if we are following the guidelines? Are we going to be able to start to do that? What about dog parks? These are some of those other questions that we're getting relative to that.
Unfortunately, none of those are allowed right now. And I know it's hard and people want to go and do those activities, but it's just too risky to open up a lot of things at once. And it's much more, it's better to do this in a slow way. The absolute worst case scenario here is you open up too fast, you stop, and then you've got to go backwards and start closing things again. So I think all of the best health and medical advice of every expert locally, regionally, at the statewide level is saying a slow, gradual, building block by building block reopening, which is what we're attempting to do. And so unfortunately, sports that require passing the basketball or the soccer ball, there's just a lot of contact between individuals in those cases. And the same thing goes for gatherings. Those are just not activities right now. Imagine this. With the beaches, for example. In some cases, beaches, as they reopen in LA County, and you've seen them as they're discussing this, and as Long Beach is discussing this, there are places across the county where if you reopen the beaches tomorrow and allowed folks to gather, you would have millions of people on a weekend come to the beach. Millions. Imagine what would happen with possible transmission across the region just days after that. And so we have to be very cautious that we are just a week away from opening things too fast and lighting a fire on this contagious virus that will spread all across the county and the region faster than we can backtrack. And that's what has happened in other parts of the country, by the way. So it is way more smart, and it's just way safer, even though it's more frustrating, to be slow. And that is, and so for all those folks that want to open everything else, I want to see all those things open too. I'd love to see all those things reopen, have a vibrant, active city, but it is every health professional is all saying the same thing, which is it's very slow. These activities that are opening are being selected very carefully. Remember that the state health department as well is listening to some of the best medical and scientific experts, not just in the state and country, but in the world. And so that's the advice that we are listening to and trying to follow. And so we are opening things that we think are safe to do so today. I have heard from some folks say, well, we don't have that many, deaths outside of the nursing skilled facilities, which to me, 10 is a lot. It's a lot. That's 10 families outside. And certainly we've had a lot within the facilities. But remember that the reason the numbers are low is because things have been closed and we have been generally shut down. Had we been open and had just the way things were, those numbers would be so much higher. And so we really have to see if what we've already done is going to have an impact. So we might get bad news that just the tiny amount that we did will have real negative consequences in a week or two. We don't know the answer to that. So I think it's wise for us to first find out if what we just did is something that we're able to handle, or we need to slow down, or if we can take the next step. So people are going to be frustrated. They're going to be mad. I understand, but that's the approach.
Thank you, Mary. There seems to be a consensus here, but it's obviously very frustrating for a lot of people. There is a question here relating to when the city will. Is there any consideration, or has there been any discussion from the city about refunding any portion of business licenses, tobacco licenses, or any license related to non-essential business that had to shut down because of the event?
I think there actually are some discussions on those questions. And those are being discussed by the departments and the council. So I think those discussions are ongoing, and I'm sure that those will continue as well.
All right, we're going to switch over to Dr. Davis for some final health questions, and then we'll switch back to the mayor to further translation. Dr. Davis, there's obviously questions relative to your personal opinion about the percentage rate that masks or facial coverings help protect from airborne droplets. How effective are the masks, and why do we have to continue to hear that we need to use masks? It seems to be a question that a lot of people are asking, and specifically relative to essential workers.
Okay. So I don't know that it is known how effective wearing a mask is in preventing transmission. Because in order to do that study, you would have to have known people who are infected, stand somewhere and breathe, and then have people and then see who all got the infection from that person. So I don't know if that study can be done. I have seen where they kind of looked at a whole bunch of different things in different countries to see what was effective. And I don't know if it was using a lot of statistical modeling type of programs or what have you, that they did see that wearing a facial covering was something that they saw made a difference in the transmission of COVID-19. I think because it's a novel coronavirus, there's a lot of things that we don't know. There's a lot of things that we are learning. One of those things that we've learned is that you can be asymptomatic and you can transmit this virus. We also know from other types of coronaviruses, like the types that cause the common cold, that it is droplets. So it is your coughing and sneezing and singing and talking and releasing those droplets into the air is what is very easy, or the way that someone else can get it from you. And so it's kind of just putting two and two together, that we know that this is the way you can transmit it. We feel that wearing a facial covering helps that. It provides a barrier to those droplets getting out and infecting someone else. And we know that you could be contagious when you don't have symptoms. So kind of putting all of that together and trying to find the best things that we can do, given the fact that we don't have vaccines and we don't have treatments, that this is, one of the things that we think can help. So, is it like we can say, oh, it's 50% effective, it's 90% effective? No, we can't say that. But in the era that we're in, where we're having transmission, we're trying to open things up, I think it behooves us to do whatever we can to try to prevent transmission of this virus.
Thank you, Dr. Davis. One more question as it relates to your interaction with other medical professionals in the medical community. There's questions here that a lot of people have seen the impact on their clinics and their doctor's offices, that they're really not being able to get some of those general medicine inquiries taken care of or their checkups. Has there been any conversation about when we might be able to see some of that happening? Because according to some of our viewers here, they're not seeing it on any of the plans as far as when there might be a return to some of those non-COVID related care or efforts happening at our medical facilities.
Thank you for that question. So the governor actually said a few weeks ago now, I believe, that routine and general medical care could resume. In many local stay-at-home orders, healthcare, because it's considered an essential function, was not covered under their safer at home or stay at home or shelter in place orders. So they were always sort of exempted and were able to continue services. However, there were a lot of guidances from the CDC and other places recommending in this era that they discontinue or go down on the amount of preventive care and really focus on telemedicine and urgent types of visits. The governor has said recently that those services could resume. So what medical providers and medical groups need to do is to look at how much PPE they have. That's really important, that they have enough PPE if they need to take care of people. And making sure that they have worker protections in place. So making sure that they're doing the physical distancing, that they have barriers, that they've adjusted their workflows to minimize the risk of transmission. So there's nothing really preventing anyone from doing preventive healthcare services at this time. It's just making sure that you're putting the necessary precautions in place to minimize risk to both your workers and to your patients.
Thank you, Dr. Davis. We know there's a lot of questions that are out there that we maybe weren't able to get an answer specifically, so we encourage people, if you do have questions, to please reach out to us at 562-570-INFO for additional information. We'll try to provide those responses to you. Mayor, back to you.
Thanks. And now we'll do our translation in Spanish with Teresa Ayala Castillo from the Health Department.
Gracias, alcalde. Buenas tardes. Hoy es nuestra sesión informativa para el 11 de mayo. Como de costumbre, comenzamos con la actualización de nuestros números. Un total de 953 residentes de Long Beach han tenido pruebas positivas de coronavirus. Aproximadamente 620 se han recuperado y lamentablemente hemos perdido 45 residentes por este virus. A este momento tenemos aproximadamente 50 personas que están en el hospital. 35 de estos fallecimientos están asociados con centros de enfermería de atención de largo plazo. El sábado pasado hubo un evento de distribución de comida en North Long Beach. La ciudad de Long Beach, Food Finders y CalFresh se reunió para proveer a los residentes con fruta, carne y productos secos completamente gratis. Me orgullece anunciar que esta distribución dio a 2,600 cajas de alimentos suficientes para alimentar a 10,400 personas. Me gustaría agradecer al miembro del concejal de North Long Beach, Rex Richardson, y a la senadora de California, Lina González, al Banco de Alimentos de Los Ángeles y a nuestros amigos en labor por organizar este evento exitoso. Las pruebas continúan siendo una prioridad para la ciudad. Hasta la fecha se han realizado más de 17,000 pruebas en Long Beach, pero debemos seguir haciendo más. Los datos de pruebas son útiles para determinar los próximos pasos del proceso de reapertura. Si tiene síntomas de coronavirus o le preocupa haber tenido contacto con alguien que tiene el virus, hágase la prueba. Las pruebas también están disponibles para todos los trabajadores esenciales, independientemente de síntomas. Para programar una cita de prueba, visite a longbeach.gov /COVID-19 o llame al 562-570-4636. Como muchos de ustedes saben, algunas empresas adicionales abrieron el viernes solo para servicio de recogida y entrega en la calle, sobre la curva, con protocolos de seguridad que incluyen distanciamiento físico y limpieza adecuada. Rutas también se abrieron el viernes con medios apropiados de desinfectamiento físico. Los senderos están en centros de naturaleza y el parque de Willow Spring. Una vez que se implementaron los protocolos de seguridad adecuados y las operaciones comerciales modificadas, se abrieron también los campos de golf. Todas nuestras decisiones de reapertura continuarán basadas en las pautas establecidas, los indicadores de salud y los datos. Ahora hablaré sobre 2 reaperturas que están sucediendo hoy. Mientras no estamos listos para reabrir las playas para uso normal, hoy hicimos un paso significativo al abrir los senderos para bicicletas y para que personas puedan caminar a lo largo de la playa, con protocolos de seguridad establecidos. Hasta nuevo aviso, estos caminos están abiertos al público y se pueden utilizar siempre y cuando se sigan los siguientes protocolos de seguridad. Se requiere el distanciamiento físico. No se reúnan en grupos ni permanezcan en ningún lugar excepto cuando sea necesario para descansos breves. Los centros de tenis también son permitidos abrir hoy con las siguientes pautas de seguridad. Se requiere que el protocolo de distancia física esté en lugar antes de reabrir. Espero que sigamos avanzando lentamente para seguir reanudando nuestras vidas y la economía en las próximas semanas. Una parte de esto tiene que ser el comienzo del barrido de calles para garantizar que nuestro programa de barrido de calles esté funcionando a plena capacidad. Es por eso que tenemos que comenzar a partir del lunes 18 de mayo. Dejamos de emitir multas de barrido de calles cuando esta pandemia comenzó para brindar alivio de estacionamiento a los vecinos afectados. Y a las calles solo pueden ser barridas de manera efectiva cuando los autos están fuera del camino de la barredora. Sabemos que esto es un momento muy difícil y muchas personas están en casa en tiempos que no habrían estado en el pasado. Para ayudar, hemos puesto disponible 4,300 espacios de estacionamiento en 3 lotes de playa, en bibliotecas y en estructuras de estacionamiento. Hasta la fecha, hemos emitido 1,300 permisos de estacionamiento gratuitos. Quiero recordarles a todos que cualquier reapertura que hagamos estará guiada por los datos y no podemos ir más allá de lo que el gobernador permite. Para Long Beach, los datos muestran que podemos reabrir lentamente porque tenemos visto nuestros números de hospitalización establecer y tenemos una tasa de capacidad de camas de 50%, un total de 1,500 camas de hospitales en toda la ciudad. Aumentamos nuestro surtimiento de equipo de personal hasta el punto que hemos podido distribuir 100,000 de equipo de protección personal. No queremos perder los grandes logros que hemos hecho. Al abrir lentamente, nos aseguramos de seguir teniendo la capacidad que necesitamos en nuestros hospitales y de poder proteger nuestra ciudad. He hablado mucho sobre esto y quiero terminar por decirles que por favor llenen su censo. Es muy importante para la ciudad que nosotros tengamos todos los requisitos necesarios. Con su ayuda podemos tener esto si es que nos ayudan por completar el censo. Puede ir al mycensus.com para completar su información. Ahora les quiero decir un poco de lo que habló la doctora Davis. Ahora que los espacios de aire libre se están abriendo, quiero volver a enfatizar la importancia de lo que dijo el alcalde sobre mantener la distancia física y usar coberturas de cara. Cuando emitimos los pedidos de más de seguros en casa, fue rápido como apagar un interruptor de luz. Ahora que todos estamos tratando de volver a la normalidad, tenemos que pensar que lo mismo tiene que suceder, pero tiene que ser despacio, poco a poco. El contacto cercano innecesario con personas ajenas que no son parte de su hogar sigue siendo tan riesgoso como lo fue hace unas pocas semanas atrás. Lentamente, con cuidado y de forma gradual, regresaremos a nuestra actividad para minimizar este riesgo. Mientras usted disfrute de la reapertura de senderos, caminos de instalaciones recreativas, por favor siga manteniendo la distancia física de siquiera 6 pies. Sabemos que es muy difícil no unirse con sus familias y amistades, pero todavía no estamos listos para esta etapa. Reuniones con personas que no viven en nuestros hogares todavía es prohibido. Si nos movemos muy pronto, podríamos ver más aumento de enfermedad, entonces tendríamos que retrasar nuestros logros. La mejor cosa que podemos hacer para nuestros queridos es estar seguros y quedarnos en casa. Por favor, llámeles por teléfono, visíteles por Zoom y por video, pero es muy importante que todavía no se reúnan. Muchísimas gracias.
Gracias, Terry, and thanks again for watching. And again, just stay safe, everyone. This should be a very, it'll be a very interesting week for us for the data and to see kind of where we are towards the end of the week. And we're just hopeful that things continue to go in this direction. And stay safe, and we'll see everybody on Wednesday. Thank you.